Dear respected guests and colleagues, welcome to Words of Inspiration. Today's live session is titled Stop Guessing, CBT or Mindfulness. My name is Masood Saeed. I am a psychologist. This lecture invites you to move beyond assumptions and begin observing human behavior with clarity, discipline, and ethical responsibility. Islamic perspectives on well-being complement evidence-based therapy. Al-Balkhi outlined mental health hygiene and cognitive habits ideas echoing CBT's reframing and behavioral activation. Al-Ghazali emphasized muraqabah and tafakkur, mindful awareness, reflection, and aligning actions with values. Traditions of sabr and tawakkul cultivate acceptance, patience, and calm focus, not passivity similar to mindfulness attitudes. Work with qualified clinicians. Integrate dhikr, breath awareness, and journaling where culturally and spiritually appropriate. Emotionally focused therapy focuses on adult attachment, how partners reach for and respond to each other. Through structured conversations, couples identify negative cycles, share softer emotions, and build secure bonds. Internal family systems sees the mind as parts protectors, exiles, and a core self that is calm and compassionate. Therapy helps you befriend parts, unburden pain, and lead from self. The Gottman method is a research-based couples approach. It strengthens friendship and trust, improves conflict skills, nurtures fondness, and teaches turning toward bids for connection. Differentiation approaches, rooted in Bowen theory, cultivate a solid self while staying connected. You learn to manage anxiety, reduce reactivity, and choose responses instead of triangles and cutoffs. Choose EFT or Gottman for relationship patterns, IFS for inner conflicts and trauma burdens, and differentiation when reactivity in family systems dominates. Work with trained clinicians for best fit. On this crisp new year of 2026, many of us find ourselves reflecting on the year past and looking toward the year ahead with hopes for greater peace and happiness. When we seek help for common struggles like worry, persistent sadness, overwhelming stress, we often encounter two highly recommended paths: cognitive behavioral therapy, mindfulness. Both are celebrated for bringing relief and fostering resilience, yet they are not interchangeable tools for every situation. Understanding the fundamental differences between them is the first crucial step toward making an informed choice for your mental health. This guide acts as a clear, simple map illuminating what each method entails, how they work. CBT is a structured, hands-on workshop for your mind. It operates on the principle that our thoughts, feelings, and actions are interconnected. Thoughts, feelings, actions. CBT teaches practical skills to identify, challenge, and change unhelpful thought patterns and related behaviors. Identify, challenge, change problematic behaviors stemming from thoughts. Its active and collaborative therapist and client work together like coach and athlete to set goals and practice new mental habits. The core idea: reshape thinking and modify actions to influence emotional well-being and improve quality of life. In contrast, mindfulness invites you to be a gentle observer of your inner world. Its central practice is paying full attention to the present moment thoughts, your feelings, sensations in your body without judgment. Rooted in ancient contemplative traditions, mindfulness creates space between you and your experiences. Rather than fighting thoughts, you learn to notice them, acknowledge their presence, and let them pass like clouds. Notice them, acknowledge their presence, let them pass by. This cultivates calm awareness, reduces reactivity, and fosters a peaceful state of being. Imagine you are stuck in a traffic jam and anger rises. CBT might question the thought, "This is a disaster, my whole day is ruined," and replace it with, "This is frustrating, but I can use this time to listen to music." Mindfulness would have you notice the anger in your body, clenched jaw, tight chest, and simply observe it without getting carried away. The historical roots of CBT are relatively modern, emerging from the work of pioneering psychologists in the 1960s and 1970s. Dr. Aaron T. Beck initially a psychoanalyst, noticed that his depressed patients often had a stream of negative automatic thoughts that shaped their moods. He developed a structured therapy to help patients identify and evaluate these thoughts, which became the foundation of cognitive therapy. Around the same time, Dr. Albert Ellis created rational emotive behavior therapy focused on identifying and disputing irrational beliefs. These approaches shifted psychotherapy from digging into the past to a practical, present focused effort to change thinking and behavior, establishing CBT as a robust, evidence based treatment. Mindfulness, in contrast, operates on the principle of awareness and acceptance rather than active change. It teaches you to anchor your attention in the present moment, often using the physical sensation of the breath as a focal point. When your mind wanders to the past or worries about the future, gently return. This repeated action is like a workout for your brain's attention muscles. Over time, it helps you become less entangled in your thoughts and feelings, allowing you to respond with greater clarity and calm. While CBT is a product of 20th century Western psychology, the practice of mindfulness has a much longer history, tracing back thousands of years, particularly in Buddhism. John Kabat-Zinn brought it into Western healthcare with MBSR in the 1970s, an 8-week secular program for pain and stress. Its success paved the way for mindfulness-based interventions in therapy and medicine. Cognitive behavioral therapy is not a single monolithic approach, but rather an umbrella term that covers a family of related therapies. Each type shares the core principle of addressing thoughts and behaviors. They have unique focuses and techniques tailored to specific problems. The most well-known form is standard CBT, the direct application of Aaron Beck's model. It is a highly structured method, focused on identifying negative automatic thoughts, assessing their validity, developing more realistic and adaptive ways of thinking. This approach is widely used and heavily researched, used for depression and for anxiety disorders. Another branch is rational emotive behavior therapy, developed by Albert Ellis. REBT is direct and sometimes confrontational. Ellis's ABC model, activating event, belief, consequence. REBT says rigid, absolutist beliefs, words like must, should, ought cause turmoil. A therapist helps challenge those dogmatic beliefs and replace them with flexible, rational preferences. A third major type is dialectical behavior therapy, created by Marsha Linehan for borderline personality disorder. DBT combines CBT techniques with mindfulness and emotional validation. Dialectical means bringing together acceptance and change. DBT teaches 4 key skills: mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness. Together, these provide a robust framework for building a life worth living. 2 other therapies expand CBT with acceptance and mindfulness. Acceptance and commitment therapy encourages individuals to stop struggling with painful thoughts and feelings, accept inner experience, and act on values. Schema therapy, developed by Jeffrey Young, is a longer-term approach for deep-seated chronic problems. It identifies and heals long-standing patterns, blending cognitive, emotional, and relational work. Voiceover. While CBT and mindfulness cover a lot of ground, some challenges are better met with other complementary approaches. Emotionally focused therapy, EFT, attachment at the center. It maps the negative cycle between partners. Blame gives way to vulnerability. Primary emotions are named. Safety is rebuilt through bonding events. best for couples in distress, also helpful for individuals with attachment wounds. Internal family systems, IFS, paths, language, protectors, exiles, and a calm, compassionate self. Unblend from apart, listen, unburden. Integration over suppression, often chosen for complex trauma, shame, and inner conflict. Mindfulness friendly, experiential, gentle. The Gottman Method research based tools for couples. Strengthen friendship and trust. Manage conflict without the four horsemen: criticism, defensiveness, contempt, stonewalling. Build love maps. Use softer startups. Set rituals of connection, clear exercises, clear feedback, good for partners who want structure and skills. Differentiation from Bowen family systems, advanced by clinicians like David Schnack. Stay connected while staying self-defined. Less fusion, less reactivity. More courage to soothe yourself under pressure. For enmeshment, codependency, and the push-pull of closeness and autonomy. How to think about fit. If your main pain lives between people, go relational, EFT, or Gottman. If your struggle lives within conflicting parts, harsh inner critics, IFS. If boundaries blur and anxiety drives reactivity, differentiation work. These can stand alone or combine with CBT tactics and mindfulness practice. Skills for the head, presence for the heart. Determining whether CBT or mindfulness is the right fit often comes down to the nature of your problem and your personal preferences. Cognitive behavioral therapy tends to be highly effective for specific, well-defined problems with a structured, goal-oriented approach. If you are struggling with panic disorder, social anxiety, or obsessive-compulsive disorder, CBT offers concrete strategies to confront fears and change avoidance behaviors. It provides a clear roadmap with homework and skill-building exercises which can feel empowering for active problem solvers. CBT is also an excellent choice for many people experiencing depression. CBT targets cognitive distortions, catch them, evaluate the evidence, and generate more balanced and compassionate self-talk. Logical, analytical, and progress-motivated people often thrive with CBT. If a clear plan, tracking thoughts, and systematically testing beliefs appeals to you, CBT likely fits your learning style. Mindfulness is particularly beneficial for general stress, overwhelm, worry, rumination. If you feel buffeted by emotions or racing thoughts, mindfulness teaches you to anchor in the present and reduce reactivity. Those drawn to contemplative or body-based practices like meditation or yoga often find it a natural fit. It's recommended for chronic pain and stress-related conditions. Pay attention to sensations without judgment to lessen suffering. Mindfulness-based cognitive therapy can be exceptionally effective in preventing relapse for recurrent depression. For those at war with their thoughts, seeking peace and acceptance, the path of mindfulness offers a powerful, gentle alternative, that can really change how you relate to experience. While both CBT and mindfulness are powerful and generally safe, there are situations where they may not be the best first choice or need extra care and professional guidance. For CBT, the structured and demanding nature can be a barrier. In severe life crises, recent trauma, profound loss, or acute psychosis, people may lack resources for homework or structured thinking exercises. Stabilization and support often come first before cognitive work. Significant cognitive impairments or learning disabilities can make abstract thought work difficult. Those wanting deep emotional exploration may find problem-solving CBT invalidating. Relationship-focused or trauma-informed approaches may be better starting points. Mindfulness also requires caution for some individuals. With significant trauma, especially dissociation, turning inward can be dysregulating without guidance. Use a trauma-informed teacher to build safety and start with external anchors, sounds in the room, then gently turn inward. In acute psychosis or unmanaged bipolar mania, use mindfulness only with extreme caution under close medical supervision. Manage expectations. Mindfulness is a practice, not a quick fix. Benefits are slow and cumulative with regular practice. When standing at the crossroads between CBT and mindfulness, having a simple, direct comparison can help clarify which path to take. Think of it as choosing the right tool for the right job. If your primary need is for rapid, targeted action and you want a clear, structured plan to follow, then cognitive behavioral therapy is likely your best bet. It is the therapeutic equivalent of a detailed instruction manual for rewiring your brain's responses. CBT excels with specific issues like phobias, panic attacks, and social anxiety, where changing particular thoughts and behaviors brings quicker relief. Conversely, if your goal is to reduce general reactivity and cultivate calm and acceptance, then mindfulness is the more appropriate choice. If loops of rumination, strong emotions, or chronic overwhelm dominate, mindfulness teaches stepping back to observe without being controlled. Imagine Anna, terrified of public speaking, about to turn down a promotion. CBT helps identify and challenge. Everyone will think I am an idiot. Then build step-by-step exposures, starting with trusted colleagues. Now consider Mark, a successful manager, stressed, irritable, and unable to switch off at night. Mindfulness teaches breathing and observing work thoughts without engaging so he can be present with family. Ultimately, the choice need not be either or. Modern therapy often integrates both approaches. MBCT and ACT exemplify this synergy, mindfulness plus cognitive skills aligned with values. If both problem solving and gentle acceptance resonate, seek a therapist trained in these integrated methods. As our journey through CBT and mindfulness comes to a close, it is clear both offer invaluable resources for the human mind. Neither is inherently superior. Their power lies in applying the right method to the right person and problem. CBT equips a practical toolkit for changing thoughts and behaviors, structured and goal-oriented. It is the engineer's approach. Mindfulness offers the observer's path, acceptance and present moment awareness, cultivating inner peace over time. Ask yourself, what is the nature of my struggle? A specific fear or general stress and reactivity? What is my personal style, structure and plans or contemplative acceptance? Next, consult a qualified professional psychologist or counselor, share your goals, ask about CBT and mindfulness training and how they'll tailor care. The therapeutic relationship is key. Choose someone you trust. This is a process of discovery. You can start with one method and later blend the other. By making an informed choice, you give yourself a powerful gift, one small, intentional step at a time. For many Muslims, the path forward blends science with spirit, tie your camel, and trust in God. CBT offers the tie your camel clear plans, thought records, and step-by-step change. Mindfulness supports trust, settling the heart in remembrance, patience, and presence. Consider these alignments. Intention, niyya, with goal setting, make your change an act of worship and service. Muhasaba with CBT, thought logs, notice patterns. Challenge harsh self-talk with Husn al-Dan. Dhikr and breath awareness with mindfulness. Steady the breath. Repeat a short remembrance. Return without judgment. Sabr and tawakkul with exposure work. Take graded steps while leaning on prayer and support. Shukr with mood practices and sessions listing 3 gratitudes to retrain attention toward blessings. Rahma, self-compassion. Speak to yourself as you would a beloved friend. Firmness without cruelty. Values with action align behavior to adab and maqasid. Mercy, justice, preservation of life and mind. Seek culturally competent care. Ask a therapist how they integrate faith or collaborate with an imam or chaplain. For scrupulosity or waswasa, favor clinicians' experience with OCD and religious concerns. Community matters family, masjid, trusted friends, build a circle of support. Your faith does not compete with healing, it deepens it. Take the next step, a brief dua, a mindful breath, one reachable goal, tie your camel, then walk with trust. Don't forget to like, share, and subscribe to stay connected with more inspiring content. Your support helps us reach more people and keep these important conversations alive. I'd love to hear your thoughts, questions, or personal experiences. Share them in the comments below. Your voice truly matters. Together, we can build a meaningful dialogue that benefits us all. Thank you for watching. May this video serve as a source of knowledge and reflection